Check. Can you hear me? Hello, hello. Are you able to hear? Good afternoon to all the esteemed participants. It's my absolute privilege and honor to welcome our distinguished guest, Mrs. T.N. Nirmala, Assistant Professor in the Department of Trauma Care Management at Sri Ramachandra Institute of Higher Education and Research, to today's Faculty Development Program on Basic Life Support and First Aid. Mrs. Nirmala is a highly accomplished professional with over 2 decades of experience in emergency medicine and trauma care. Since 2005, she has been a driving force in clinical practice, research, and education. Her academic rigor is highlighted by dual qualifications in trauma care and psychology, her PhD research on trauma scoring systems, and publications across Scopus Index journals. Beyond her clinical expertise, she is a pioneer in shaping healthcare education in India. She was instrumental in developing the national curriculum for trauma care professionals, an achievement recently recognized with the prestigious Curriculum Development Contributor Award 2025. She is also a certified AHA instructor, an ITLS provider, and an instructor for courses in collaboration with the Royal College of Edinburgh. Yet, what truly sets Mrs. Nirmala apart is her unwavering dedication to her students and her genuine passion for teaching. I would also like to extend a very warm welcome to all our participants joining us today, both in person and online. Your presence makes this international program truly meaningful. Ma'am, on behalf of our department and everyone present, we are absolutely delighted to have you and your team with us. We look forward to gaining valuable insights from your vast expertise. Welcome, ma'am. Welcome to all our participants. Thank you.
I know afternoon session it will be a little bit difficult. We'll have a 2 minute ice breaking. Okay, like exercise. Okay, can you all get up, please? It's okay for you to get up. If I all say one, the people should jump. For all like 2022, right? You all should jump. If I say one. If I say two, you all should clap. Bringing your hands like this. So one, you should jump. Now it's okay. Okay, one, you can all jump. Two, if I say three, you should be on in prayer. Attention. Okay. Okay. Two, three, three, three. What you should do? Attention. Challenge is attention. In prayer, you will do right. Three, one, one, two, two, three, three, one. Okay, then all. Thank you. Actually, post lunch, it will be sleepy only, just to make you all awake. Okay, I'll try to complete the section as much as possible. Okay, what do you mean by basic life support? What is basic life support? Oxygen is then yes, good. Then first aid care, excellent. Okay, so basic life supporters, you are not having any equipment with you. Okay, but you want to save the life of the patient. That is basic life support. Basic is without having any equipment, with only my knowledge, life is you're going to save the life of a person and supporting them. So that is basic life support. So if you found a person in your area or while you're going for a park, you're walking, you find a person collapsed. So what you will do first? Check the breath. Okay, before that, scene safety. The person maybe fell down in an access area. So I don't know whether the sharp object or there's something else is there. So scene safety. So I should be safe. So there are three safety. Safety one, two, three. Safety one is my safety. Always rescue safety is the prior important. I should not be a victim at any point of time. Second is scene safety. Third is patient safety. Suppose you don't know swimming, you enter into the swimming pool. No. First, our safety is important. Let a person come and rescue the person from the pool, and then I will take care of the patient. Suppose there's electrical injury or fire or earthquake or bomb blast. Until the area is safe me to enter, I will not enter that area. Okay, because my safety is more important than others. So these are the three safeties. So what are safety 1 to 3? Safety 1 is rescuer. Safety 2 is scene. Safety 3 is patient safety. Okay, my scene is safe now. Okay, after COVID, it is advisable to wear the mask and the gloves. Okay, I'm wearing my mask and the gloves. Now what I'm supposed to do? As you said, you can go and check for the responsiveness. Okay, I should go and tap near the patient and to the ear, either by the under sir or ma'am, I should ask them, sir, are you okay? Ma'am, are you okay? Louder. I should tap and shout. There is no response. So what I will do? We are normal humans, so we should call for humans. We need someone to help. So what I can tell, suppose I know our name. Okay, I will tell her, Binu, can you please call to ambulance and get AED, automatic defibrillator. I don't know any one of your names. So I will tell Multicare Flora Salvar ma'am, can you please activate ambulance? So I can call that. Suppose I tell randomly, will you do? No, you will be having the interest in taking the cell and placing into death. So she pinpoint someone. She pinpoint someone, either their dress code. If you know their names, you can tell off with their names. Okay, so before the help arrives, what is supposed to do next? I should check, you told for breathing. So I can check my patient breathing and the pulse. Okay, bend down, look for the chest movement, listen for the breath sound and feel for the expired air. So look, listen and feel. Okay, so bend forward and look for the carotid pulse and the breathing. So carotid pulse, so this is the trachea. So lateral to that, you can feel for the pulse. Okay, one side you should feel. Two side if you feel and occlude, the artery will compress. Okay, 10 seconds I should count. Not less than 10 seconds, not more than 10 seconds. So no pulse, no breathing. It's normal or abnormal? Abnormal. Think it is absence of breathing. Okay, whether you found a gasping sound, I don't know. I'm a non-medical person. I just know what is first aid. So I should think it is absence of breathing. Okay, so what I'm supposed to do now? No pulse, no breathing. Start the cardiopulmonary resuscitation. That is CPR. Starting the cardiopulmonary resuscitation. So what is cardiac? Pulmonary is lungs. Resuscitation is you are going to treat the patient or save the patient by your ways of doing chest compression. Okay, so what is how do you do chest compression? Yes, you place your dominant hand on the patient center of the chest, and you should interlock it. Your shoulder should be straight, spine should be straight. The support should come only from your hip muscles. Okay, so once you interlock this, you should go do it for 30 minutes, 30 compression. Okay, you should count like 1, 2, 3, till 30 you count. After counting, I will come to the head end. After 30 compression, I will come to the head end, and this is called ampu bag. This is called ampu bag. So I can place the ampu bag like this in the patient face. That is compression elevation. Easy clamp technique. Okay, once I place it off, I will squeeze half of the bag because the volume of this bag is 1500 ml. So I can't be able to deliver and hyperventilate the patient or overinflate the air. So I want to squeeze only half of the bag for 2 times. And each time I do, I should watch for the chest rise. So 30 compression, 2 ventilation. How long you can do? 5 times for 2 minutes. Again, I should reassess the patient by checking the pulse. Okay, suppose when you check, patient is having the pulse, but there is no breathing. What you will do? Which is absent, you can give that alone. No need for chest compression. Okay, so the patient is having the pulse, no breathing, give one rescue breath every 6 seconds. I'll place like this and give one breath. And I will count like 1 in 1000, 1 in 2000, 1 in 6000, I will count and I will breathe. So if you tell 1, 2, 3, 4, 5, 6, it will take only half second. So when you count like 1 in 1000, it will take 1 second. 1 in 2000, 3 in 3000, 4 in 4. You can count like that. Okay, then I should press. Don't have this. Okay. Okay, every paramedic professional or healthcare professional will have this pocket mask. They will have this pocket mask with the inflatable valve. So what is the advantage of this valve is whatever air I inflate to the patient, it goes from my mouth to the patient lungs for inflation. Okay, from the patient, the expired air will not enter into myself. So that is the advantage. So even though the patient is having hepatitis or AIDS positive, so no need to bother. Okay, because it's a one-way valve mechanism. Whatever air you are giving will be going to the patient. Return air will not come into back to you. So it is like one-way valve mechanism. Okay, suppose I don't have this. I have only this. This is mouthpiece. I can have this and I can blow. But here you should use a small gauze. Side pockets. Okay, you don't know anything. You don't have anything to give mouth to mouth or something else. What you will do now? You still want to give with your bare mouth to the patient, bare mouth. It's recommended. You don't have any barrier device with you. You don't have your shawl, don't have your hanky, anything. Is this safe to recommend and give? No, it is not recommended after COVID. Just alone, compression can save the life of the patient. Okay, you have your shawl, you have an hanky or a clean cloth, you can try. That too for a known person. It can be your auntie, uncle, or neighborhood, where you are aware of their health condition. If you feel reluctant, the patient is known about the medical condition, don't give by any means of breathing, except you have this device or the ampu bag. Okay, always keep your chest compression will save the life of the patient. Okay, this you forgot if you don't have any barrier device. Okay, so the first safe see 1, 2, 3. Second is check for response. So I am tapping and shouting. There is no response from the person. I am calling help and ask her to activate the ambulance and get an automated external defibrillator. After that, I am supposed to check the carotid pulse and breathing simultaneously. No pulse, no breathing. No pulse, no breathing. Start your cardiopulmonary resuscitation. Okay. So for clear. Okay, so the purpose too. So when you're doing compression, what you're pumping actually? You're pumping the art. That is, you're pumping the blood from the art. Okay. So the art is supplied with coronary circulation. So that is the second C. First C is chest compression. Second C is coronary circulation. And third C is by pressing the coronary circulation, we're going to improve the cerebral circulation of the brain. So the brain will eventually die in 3 to 4 minutes. After that, if you water resuscitation do it like no hope at all. Okay, so make sure you are just pressing the chest as soon as possible before the brain is dying out. Okay, so got an idea now, right? So for whom you will give basic life support when you see the person in cardiac arrest. So what is cardiac arrest? No pulse, no breathing. If you found a person seems to be unresponsiveness with an abnormal heart rhythm, it is cardiac arrest. Okay, so what is heart attack then or MI? What is heart attack? Heart attack is the patient will be in semi-conscious or consciousness with lot of sweating coming out. The patient may speak to you and they will tell, I'm having severe chest pain over here. So they'll be able to at least tell you what is happening out. But cardiac arrest, completely switched off. They will not have any response. So cardiac arrest is different, heart attack is different. Then respiratory arrest. My pulse is good, but my lungs is not functioning properly. That is respiratory arrest. Third is obstructed airway. I'm eating some gobi or mushroom 65 and it got into my throat. So that gets my airway obstructed. So that is the third reason. So for this three, you will do a basic life support. One is cardiac arrest, second is respiratory arrest, third is obstructed airway. So what you will do in cardiopulmonary resuscitation, you will pump the blood to the brain, to your lungs, to your other systems of the body. Then you will give the ventilation with the barrier device or with the proper ampu bag. Okay, so whom will you what are indications to start the cardiopulmonary resuscitation when you found the patient unresponsiveness and with pulses. Absence of breathing is equal to gasping. In the patient gasp also, it's after breathing only. Don't think the patient is breathing out. Okay, you should start your chest compression and the breathing. So, cab, you remember, at least weekly once you use cab to go somewhere, right, with your family or for yourself. So, cab, compression, airway, breathing. That is cab. So, what you are doing now? Compression. Then I'm supposed to open the patient airway. So, I will open the airway by using ETIL. This is ETIL. Suppose you see a non-trauma patient, medical patient. So, this is ETIL. This is chain lift. Then suppose she got trauma, she skipped from a two-wheeler. Then I should suppose to do a jaw thrust. Tilt, chin lift, jaw thrust is triple maneuver. Okay. So you do for non-traumatized patient, you will do a tilt and chin lift. For trauma victim, you will do jaw thrust. So all together it's called a triple maneuver. You will do either a tilt chin lift for a non-trauma victim, for a trauma victim, jaw thrust. So you open airway. So when you open the airway like this, your airway will be straight. Okay, the main reason for the patient to become unconscious is your tongue falling back. When you do the airway straight, it will prevent the tongue to fall back. Okay, so compression are done, airway you open. Next, what you will do? Breathing. You should give breathing, artificial ventilation. So if you have an amp bag, you can use. Otherwise, don't care of breathing. So clear compression, airway, and breathing. So this is called something called chain of survival. So if you see a patient I have your phone and it is an nobody is there around me. What I'm supposed to do now? I will call for ambulance. So immediately after calling for ambulance, meanwhile coming, I'm a first aid trainer. So what can I do? I can do a cardiopulmonary resuscitation. Next, defibrillation. So fibrillation is something which is fibrillating out in the heart. So what is DE is either to stop or remove the fibrillation mechanism. So I'm giving the shock and I'm stopping the shock and restarting the heart again. So that is defibrillation. For that only we are making the ambulance to arrive. So they will bring either the defibrillation machine or an automatic defibrillator. Then when you reach the hospital, they will start an advanced life support care. Next is reach the hospital as soon as possible, recovery and post cardiac arrest care. Okay, you should monitor the patient at least for 36 hours after the cardiac arrest. Why? Yes, very good. Again, you can have a re-arrest. To add that, always make sure every half an hour a sister calls and monitors the vitals. Every 1 hour she informs the physician. Okay, this is chain of survival. So we'll see how to do a stepwise sequential steps of CPR. So first is what? What is the person seeing out? Seeing safety. So he is looking around. Then second, what is second we are supposed to do? Wearing our mask and the gloves at least. Then check for response. Go near to there and shout, sir or ma'am or grandma or granny, whatever. Shout louder. No response. What is doing there? Is pinpointing. Pinpointing someone and is seeking for it. So when you ask help, ask them in a polite way, request them. Don't order them. Nobody will do. Can you please activate? So always request them, you'll get the help. Okay, he is pinpointing someone, ask help. Next is checking for the pulse and the breathing simultaneously. So no pulse, no breathing. What you will do now? Start your cardiopulmonary resuscitation. So you should be placing your hand in the center of the chest. So please one hand on the other over the breastbone and interlock with the other hand like this. Then and it's keeping directly above your hands. It is like diagonal. Okay, I should not stand here and do. It should come like this and I should be diagonal to your area. So how depth you will give? Like 2.5 inches, 5 to 6 centimeters. Then only the heart will able to pump the blood outside for an adult. If it is a pediatric child, 5 centimeters. If it is an infant, less than 1 year baby, 4 centimeters. So less than 1 year, 4, child 5, adult 5 to 6 centimeters. So what I should do? Should I keep on pressing or I should make the heart to bounce back? I should make the heart to bounce back. Then only the heart will get refilling of blood again. So always make the chest recoil completely. Then 2 minutes, 200 to 220. It should be done like 5 times. That constitutes 2 cycles. Okay, 2 minutes. So next is what I told you after compression. Opening the airway, exhale chin lift for non-trauma victims and jaw thrust for trauma victims. So mouth to mouth, we should not do at all. So we should go either with the mouth to mouth pocket mask or with the ampo bag. Okay. So how much times you repeat? 10 for 2 minutes. So something we have called high quality CPR. So high quality CPR is whatever I am doing, whether I am doing in a proper way. So first is push hard. Push hard is depth 5 to 6 centimeters. Push fast is 100 to 120 compressions per minute. Then the 30 compressions, 2 ventilation will be completing within 18 seconds max, 15 to 18 seconds. Then what I'm supposed to do, I should allow the chest to recoil completely. Suppose I'm doing chest compression, she want to give some drug. She's starting an intravenous IV cannulation. So that time I should stop CPR. So if whatever things or treatment interrupting should be less than 10 seconds, not more than that. Okay, then I should avoid excessive ventilation. So I should skew the bag off or complete? Off. If I skew completely, the patient lungs will overinflate and will cause barotrauma. Okay, then the patient intrathoracic pressure will increase out. So always squeeze off. Don't do hyperventilation too. Squeeze off completely. Never do like this. Off completely. So don't hyperventilate. Don't hypoventilate also. Next is for infant children. What is the depth I told? Infant 4, child 5. So I am alone. So till how long I can continue my resuscitation? What can be the criteria? No, time I'm not asking. The criteria. I am alone. We are not superwoman or something else. So how long I can give? Until I become tired or exhausted. Then I am tired. She come to help me. So what she will tell? You please relax yourself. I will take care of the patient. So when a qualified help arrives and relieves me, so that time taken leave. And the patient shows some signs of life, whether he or she speaks with you or have pulse or breathing regaining out. That is signs of life. So these are three criteria. Till how long you can do your resuscitation. The victim shows signs of life. Qualified help arrives and takes over. And when you become tired or exhausted. So this algorithm you can search in Google also. So what all the steps we have done in sequential steps is there. Okay, it's like what if you should search is AHA, American Heart Association, BLS algorithm 2025 guidelines. You'll get this algorithm both for adult and pediatrics. So we'll practice for adult and so on, then we'll go for a pediatric. Okay, I need 5 persons to come and you stand here, they'll show you the demo, then you can once we shift the patient to the safe place means next step, check for response. Tap the shoulder and ask for, sir, are you okay? Sir, are you okay? Please in ஒரு batch சொல்லுங்க. You can listen. Next step, we have to check for pulse and breathing. First, check for carotid pulse and check for simultaneous breathing by listening near. Okay, within 10 seconds, we have to check. Okay, if suppose there is a pulse and breathing and responsiveness, what are you going to do next step? There is a pulse and also responsive. What are you going to do next step? Call for ambulance. Put the patient in a left lateral position and until the arrival. Okay. Next, there is a pulse, but there is a no response. Means you have to give only rescue breath only. This will be tip of the nose, and this will be rest on the cheek. You have to use easy clamp technique. Like C means compression and E means elevation. Elevate like this, and you will give one breath in every 6 seconds. Okay, one, you can see the chest rise. Like 1, 2. Rescue breath if you given means this is the respiratory arrest. If suppose cardiac arrest means there is more responsiveness. You're going to do CPR. How means the center and the elbow should not be bent and it should also not be bent. Okay. Next you have to give 1, 2, 3, 4, 5, 6 like this 30 compression you are going to do. Okay. Next Next, also you have to go to the head and side. Same like C easy clamp technique. Give 1 2 rescue breaths. You can perform. If you have any doubts, how can I come to every? Can I come manually or like you can give actually 2 pumps. 2 pumps. Again, you have to give compression. Like you will give one, next 1 2 3 4 5 6, next one. Yes. You can alternatively go to this. You can do. I will help you how to perform. First, you can check the verify the scene. Next, check for response. How you can check the response? Sir, are you okay? Sir, are you okay? Or madam, are you okay? Next step, pulse and response. Like first, you have to look the Adam samples here, and laterally the carotid artery will be there, and also simultaneously check for breathing. Within 10 seconds, you have to check. If there is a, if suppose there is a both, what you going to do? Okay, until you have to put the patient in left lateral position. Next, you feel pulse. There is no response. What you going to do? It means respiratory arrest. You going to the head and side and give rescue breaths. You go to the head. You go to the head and side of the patient. Like this. Be like and compress the mask. Yes. Like easy clamp technique. Compress the mask by your hand. Compress the mask. Like this. Compress. C. Compress means C. E means elevate the chin. Okay. You can see if you give 1 breath means you can see the chest raise. You can see. If there is no pulse, no response. Next, you start CPR. You can come again here and do CPR. Center of the chest. Your palm should be kept here. Your elbow should not be bent. Your hip should be straight. Like 30 compression you have to give. 1 2 3 4 like that. 30 and again switch to the head. Compress and elevate and you give the rescue. Okay, sure. You tightly compress the mask. Hold in the C shape and elevate the and elevation compression. Now you do. Yes. You can 2 times. Same procedure. You can try. Let's look for same shape. Yes. First, we have to say pulse and response. If there is a no start CPR, then only we have to give rescue breaths. Otherwise, don't give first rescue breaths. First start CPR, then rescue breaths. You should be straight and your elbow should be not bent. Give full compression. How long we have to give? 30. Again, you go to the hand and you do ample should go to the head end. Go to the head end. Go to the head end and you do. No, head end, completely to head end. If there is your legs lapse, the patient only that rescue breath only alone. How means this is right hand person hold the bag in the right. Like the bridge of the nose will keep the mask. Elevate it. This mask. Open airway. Elevate the chin. You can see the buccal cord and like you can see right from chest. You can see the chest right. 2 times from the if not compress you like 30 compression to ventilation. Air will go leak. You can also so do not give effective rescue. If you have any doubts,
one second.
if you want to perform, if you can, you can come here. First, what we have to do? First, verify the scene. If scene is safe or not, we have to check out. If there is an electrical object or any sharp object is there, means we have to shift the patient to safe place. Okay? If the scene is safe. Next, what you're going to do? First, you tap the shoulder, check for response. Sir, are you okay? Madam, are you okay? Like that. There is a no response. Next, check for pulse and breathe. We have to check breathe in this hand and pulse in this hand. Simultaneously, within 10 seconds, we have to check. Okay? If there is a pulse and also breathe. Next step, what? There is a pulse. Okay? There is also a response. And you will already call to the ambulance. So until you have to put the patient in left like this, left lateral position. And until the ambulance arrives. Okay? If you put a pulse but no breath. Next step, what you have to do?
You don't have that.
Just you can do only the compression. Because there is a pulse. Okay, the heart is pumping. The lung is not. So we can do. So only we have to give rescue breath only. You have to
unless
go
you
to
know
the
in your
head
family
inside.
where we can
You to go.
apart from our outside channels, we should not do it. We should not
We'll
get
go
into
to the head
trouble.
inside. The mask has to be kept like the tip should be placed at the bridge of the nose and this should be placed on the chin of the wrist. So we have to use this easy clamp technique. How means C means compress and E means elevate. Okay. So you can give one, you can see the chest rise like 1, 2. Okay. Next, this is the respiratory arrest only. We have to give the ambubar. If suppose there is a no pulse and also no breath, what you have to do? CPR. CPR, how much ratio we have to give? 30 compression. Like the center of the chest, we have to place your dominant hand and interlace with your fingers, and you have to give like 1, 2, 3, 4, 5 until 30 compression and 2 rescue breaths you have to give. Okay, until then you have to give me. If suppose you exhausted or the victim life shown means you will exhaust. Okay, if you have any doubts, you can perform. First, verify the scene. Next, tap the shoulder. There is no response.
You people can come here and join. Prema. Prema.
Like
no
pulse and no breathing. Next step, start CPR. Next step, start CPR. There is no pulse and no breathing. Like this. You should be kneel down. You should be kneel down, and your elbow should be not. Your elbow should be not bent, and it should be straight.
No, call for it. Not do like that. Call for it. Do it properly. Do it properly.
Like the shoulder of 30 compression. You are
go here to here and sir or ma'am, whatever gender is there. No response, you can call
your
her.
elbow should be bent, you are not giving effective.
Tell her, can you please activate ambulance?
Please go for to the head and give rescue breaths.
You can check for your carotid pulse. Bend. No. Place your hand on it.
Compress and elevate.
So no pulse, no breathing. You'll start your chest compression.
Compress.
Kneel down properly. Center of the chest.
Next person.
Do.
First, verify the scene.
Don't flex your elbow.
Or not safe.
And the sound all time.
Okay. Check for pulse and breathing. Within 10 seconds, we have to check. If there is no
depth should be 5 to 6 centimeters. Can do two ventilation. Come to it and
and also you have to
air
count
open,
in your
open
mind
the
like
airway.
1, 2, or otherwise the chest not recorded.
See, air leak
And also the
tighter
hand should
compress
be
பண்ணு.
placed like
Now do
the
it.
hand should be not to take.
Do it,
The
do
hand
it.
should be
Two
not to
times.
take like one. The palm should be placed to the chest only. You have to not
Your hand
take
right.
it up and down. Yes. Ah.
One man.
Okay. And if you 30 complete means go for to the head and side and give rescue breath. You have to feel the mask like C compression and E means elevate the chin and give rescue breath. You can see the chest rise. Again, you have to perform CPR until the paramedic arrives. First, what we have to look for? Scene is safe. Okay, next. Okay, next. Don't check here. Check this one should be checked for the breath. This one should be checked for the pulse. Like this.
Oh, that is wrong.
This is the what? This is the what pulse. This is the what pulse. This is the carotid artery. Okay. Here we can check like radial pulse. Okay. This is the carotid artery. Okay. If there is a no pulse, no breathe. What are you going to do? Perform.
Straighter. Center of the chest. Right. Go one step back. Kneel down properly. Get up. Kneel down properly.
Okay, don't pressure her. First, I will perform. Okay. First, your dominant hand. If your heel should be placed the center of the chest and interlace, like your hip should be straight and your elbow should be straight. Like 1, 2, 3, 4, 5, 6, 7, like that. Okay. If wrong also no problem. I will teach you. Your elbow should be not. You will give your power from the hip to the wrist. You can hear, I think, like 1, 2, 3. That click sound here, you can hear, right? You have to do like that. If you exhausted means no problem. You can give next rescue breath. You can go to the head and side. Compress and elevate the chin. In this hand, you have to compress like C and elevate the chin. Okay. Next, give one rescue breath. You can see the chest rise. You can seal tightly. You can see good. Yeah. Next. Okay. Sir, are you okay? Sir, are you okay? Or madam? Like that. Next step. If I will give the pulse is there is no breath. What are you going to do? Only oxygen. You will go to the head and side.
Finger. Keep your finger like this.
Compress the mask. Like C. Compress the mask and elevate the chin. Elevate the chin. And also if you squeeze the mask, you also see the chest rise. Squeeze the mask. Tightly you can see. Otherwise it can leak. Able to see or not? That's a 2 breath you have to do. Next step, there is a no pulse and also no breath means what you have to go and do. Start CPR. your wrist. Like you can hear the clicks of 1, 2, 3. The rib should be like broken. Sound you can hear. Like this, you have to give 30 compression and 2 rescue breaths. Okay. You can lean down, you can sit, and you can do. Okay. Check the pulse. You have to check the pulse like this. Okay. If there is a no pulse, no breathing, what you're going to do? No pulse. The heart is not pumping the CPR. You can start CPR. Where we have to place the hand in the center of the chest. Like 30 compression. Next, 2 rescue breaths you have to give to the head and side. Compress, see, you can compress the mass like C and V. This is the easy technique. Compress the mass and elevate the chin. You can keep your hand like this. Actually, the mass should be kept like this. Now you can give. You can see the chest size. And then you have to do this. Start CPR. Okay. Mhm. English. I think got an idea, right? How to do for an adult BLS. We'll see for pediatric. Want to do that exercise back? No. Everyone is awake, right? So, what is pediatric? Till what age you call it as pediatric? 18. Till 18 years, it is pediatric. Okay. When we call it as adolescent or puberty years, when the voice change over in male, and when there is just development in female, we call it as puberty stage. Okay, less than 1 year, it's infant. More than 1 year till 18 years, it's pediatric. Okay. In less than 1 year baby for adult, what you're doing, you are tapping and shouting by his name or by his gender. For an infant, what you will do for less than 1 year baby? Or your infant baby. We should tap on the sole of the feet. We should tap like this on the sole of the feet or on the back of the scapula. Okay, no response. What you will do? Same as adult. What you will do? I'm alone. What you will do? call for help, and ask them to activate ambulance. So after that, we are supposed to check the pulse and the breathing. For less than 1 year, you should check the brachial pulse. Okay, this is the brachial pulse area. So check here, okay, or in the femoral neck. Less than 1 year, don't check the carotid. Neck will be very short. You can't able to identify. You will compress also. So always check for the brachial pulse or femoral pulse in the leg. So no pulse, no breathing. What will do now? We should do a chest compression. Okay. So how will you check for responses? You will tap on the sole of the feet, or you can hold it like this and you can tap. You check the response. If the baby cries, it indicates what? Baby is active. Baby is breathing out, and pulse is also there. Baby is having no response. It is dumb. Then yeah. So no pulse, and same time I keep my hand here. No pulse, no breathing. So baby should be in a flat, given a 1 month. Or the baby is small, encircle the baby and give like this. So it is called two-thumb encircling method. Two-thumb encircling method or one-hand CPR. It is for child, pediatric. Got it? So what will you do now? Either one-hand technique like this, or you can do a thumb encircling. The baby is bigger baby, 5 years, 10 years, with 50 or 55 kg. So you can use your both hands and you can do CPR as adults. The baby is still built, only 5 or 6 years, use one hand CPR. So clear? So same thing. Where you check the pulse in the brachial less than 1 year. Yeah. More than 1 year check in the carotid. So you can use either one hand technique or thumb encircling method. So in adult, if you're single or double, it is always 30-2. But in pediatric, if you are two people, myself and she is there, I will perform a compression of 15. She will give 2. It is 15. So this is the algorithm same for adult as a sequential step. So this is the difference between. So for adult, I will check the response, tap and shout. For pediatric or infant, sole of the feet. Even for grown adolescent, can tap. More than 10 years or 5 years, you can tap and shout. Less than 1 year alone, you should sprinkle or you can tap. Then difference between us for adult, what is the depth of the compression? 5 to 6. Pediatric 5 centimeters. Infant 4 centimeters. So infant 4, child 5, adult it is 5 to 6 centimeters, not more than that. Okay. Then this is called AID, how to demonstrate. So AID is nothing but automated external defibrillator. So this what it does is it detects the heart rhythm of the patient, whether it's a normal rhythm or abnormal rhythm. And also it tells us whether to give shock or not to shock. In airport, Phoenix Mall, Forum, and in many malls, you can see the thing. If you ask the security officer, he will be able to give you to you. Just we should know the English alone. You can operate. Either a fourth standard or fifth standard, a boy or girl can operate. It's just an English prompt. We should do as such per the rules. Then we should deliver the shock with the push of the button. Then what it does is it converts an abnormal heart rhythm to a normal heart rhythm. That is the function or usage of an automated external defibrillator. So you see how to use an AED. We have something called pass mnemonic. PASS. So P is power on, A is attach pad, another A is allow on, analyze the rhythm, another S is press the shock button if needed. Then if you have many chests, the AD it will be sticky AD. So when you press and remove, how we do back the same thing, the app will get removed. There is no time to remove all these things. You better to keep assets on the air itself. Okay, because time is running out. Within 5 minutes, the brain will die. Okay, so you should place the paddle. Suppose I'm new to the field, I know where to place. So one paddle below the right clavicle, another in the apical region. So art is here. It is like diagram. giving the shock in the diagonal way. So this is below the right clavicle and then the fifth intercostal space in the apical region. So this is how you place. Okay, by seeing the picture, you can place. Then after that, make sure the plugs are plugged into the AED. So once we charge your mobile, you see whether it is plugged out. Same thing, you should see whether it is connected to the power socket of the AED machine. Then once it advises me to shock, I should press the shock button. Before I should press the shock button, I am handling out, I am clear, one step back. If she is doing some the shock patient CPR, she will be away. You are clear. Everyone clear, everyone clear, you are clear, everyone clear. Really patient is very critical. Keep on reading out hypovolemic shock. So I should say stand clear or all clear. I can say one word and make sure nobody touches the patient. Okay. Then you press the shock button. Plus resume CPR. So again, I should continue the cardiopulmonary resuscitation. Okay, they'll show you the AED now. On this one, I will also show the demo. Okay, suppose a person eating some chicken or gobi and stuck into the throat. And she will tell Avantia, don't worry, I'm a healthcare professional, I'll take care of you. Can you cough? So this is called universal signs of choking. Okay, I'll ask her, encourage her to cough, please cough. After that, she says, I can't do. And a person, rescuer comes and she will tell to forward and she will keep her legs in between. Suppose she become unconscious, she will bear her weight. So for that, you should give the support to her. Okay. Then afterwards, ask the patient to lean forward and give abdominal thrust. That is below the sternum, above your belly button. Below the sternum, above the belly button. So for press, inward and upward thrust. 5 times. Inward and upward thrust. Then you should perform back blows in between the scapula. Same thing, inward and upward thrust. Being she is conscious already, we are not doing it harshly. But seriously, the patient has got choking, should have a nice blast actually. Inward and upward. Both abdominal thrust and 5 back blows. Okay, in this case, the patient become unconscious, should perform your basic life support again. Got it? So this is for adults. So the abdominal thrust is also called as enriched maneuver. If it is infant, I should take a chair and I should sit comfortably and I should keep my lap here and I should give 5 back blows. Okay. I should keep my leg like this and I should keep 1, 2, 3, 4, 5. Again, I should turn the baby and check the oral cavity. Okay, nothing is there. Suppose I find an object like AAA battery or any coin or any tamarind seed, I should take. If it is not visible, don't take. Then I should perform 5 chest press. Same inward and upward. Okay, so again I should perform a 5 back blows. Each time I perform 5 back blows, I'm supposed to check the oral cavity and look for any foreign object. Okay, suppose while doing also the patient baby become unconscious, perform CPR. For you try also, the baby is not responding, immediately rush the baby to the hospital. Suppose I am a mother, she is a rescuer. She will come and tell me, ma'am, I am your healthcare professional. I'm there to help you. Don't worry. Give your baby, reveal some little maneuver to release the choking object. Suppose she asks, will I give my baby to her? So for either adult or pediatric choking, always self-introduce yourself. Give them the confidence and trust on you. Once they have trust on you, definitely they will cope it with for your treatment. Even the mother will be in a panic stage. She will tell, my baby is not breathing, not speaking. I'm panicked. Please do something. Who are you? I can ask. Suppose she touches me without my knowledge, I ask her, have you came to take my baby out? She will tell, no, I'm healthcare. I'm there to help you. Don't worry. You please sit. Make sure the mother is comfortable. Then you take the baby and do it. Got it? They will show the AED demo also, and you can perform the pediatric BLS and the AED. So the summary is what? Do CPR. The patient is unconscious and no pulse. Chest compression is the only key vital important. No need for breathing if you feel reluctant or hesitant to give. Then always remember, push and push fast, don't stop pushing. Okay, then aim for early defibrillation or shock to the patient. Thank you. They will show you the uh,
This is called as a AED, automated external defibrillator. There is in a fast entry. T denotes this power on button, and A for attach the pad, and X for analyze the shock, and next step you have to give a shock. Okay. First, all of you know about BLS protocol, right? Already you all are performed the adult BLS. So next step, I am getting an AED.
Hi.
stand can வைக்கிற stand அம்மாவோட friend
எப்படி போயிட்டு இருக்கு உங்களோட ஸ்கூல்?
போயிட்டு இருக்கடா ஒரு வருஷம் அதே பிரச்சனை இருந்துச்சு. நம்மளுக்கு நிறைய இது பேரண்ட்ஸ்க்கு தெரியாது.
ஓபன் பண்ணுவாங்களாமா
இது
இந்த கடை? அதுக்குதான் வெயிட்.
இல்ல இதோ இங்க இருக்கு.
அதான் தெரியுது.
கடை ஓபன்ல தான் இருக்கு. நல்லாதான் இருக்கு. ஒரே ஒரு இது மட்டும் இருந்துச்சு. சரி அவனுக்கு எங்க போயிட்டு இருக்க?
நான் எம்எஸ்சி யோகா பண்றேன்.
சூப்பர்
சும்மா ஏதோ ஒரு கிளாஸ்.
எம்எஸ்சி பண்றியா?
During analyze the shock, we have to during I am clear, you are clear, all clear. No shock.
Stay clear of pace. Deliver shock now. Shock delivered.
Again, we have to perform start CPR. If you have to perform anybody, if you want to. Actually, this all set at like prompt. Okay, like AI. If you guys come, I will teach pediatric BLS.
You start. Very occupied by people. Not saying that it is for yeah, verify. After they was check for responsibility. But you should not tap the shoulder. You have to tap the sole of the foot of the patient. Like this, you have to tap. Same in brachial artery. Why? Because the baby's neck will be shortened. So they won't brachial artery. After the same simultaneously the function and brachial artery for first so there will be no pulse and respiration. So there are two techniques for the one is only one other is two thumb insert technique like this movement. Two thumb has to be hold this way and you have to compress. Same logic. There is two way you can use same way to use arm. We have only one or the one what is okay. It is 30. Yeah, ma'am. Anyone wants to perform? Same way, but only one hand technique and two thumb inserting technique. That's it. Totally it is 60 compression, right? 30 like 5 cycles, 2 minutes, 1 minute for 100 to 150 compressions. Same way how you do in adult, you can do in pediatric. The only changes is you wanted to check responsiveness by tapping the sole of the foot and the pulse checked in the brachial artery. Other than that, no changes. 30. 30. After giving the 30 compressions, you have to come to the side of the patient and give the respirator. After giving the respirator, you have to again perform the compression. Simultaneously, you have to do for 2 minutes. Yeah. Yeah. Until you become exhausted or the patient shows any signs of life or if someone come to help you, then you can stop doing CPR. Okay. You can perform. Just to make sure the patient is responsive or not. While you're tapping the sole of the foot, the patient can try if he or she is responding or not. Because it's like echoing. Oh, okay. Got it. You can tap. The baby is not responding. Next. After checking for responsiveness, you have to call for help and get AED. Next. You have to check for pulse, simultaneously breathing. Yeah, same 10 seconds. Pulse and breathing. So the patient is not breathing and the patient is not having pulse. Next, you have to do CPR.
Yeah, you can use one hand technique or two thumb encircling technique. Same location. Yeah, press it hard. Same, the elbow should be straight. That's it. After completing this compression, you have to come to the edge side of the patient and give rescue breaths.
This video demonstration is about the managing a victim with nose bleed. The first step is always ensure scene safety and standard precaution such as gloves, goggles and mask. Verify whether the patient is bleeding from the nose. Once it has been verified, place the patient in a comfortable position by head leaning forward. This video demonstration is about the managing a victim with nose bleed. This video demonstration is about the managing a victim with nose bleed. The first step is always ensure scene safety and standard precaution such as gloves, goggles and mask. Verify whether the patient is bleeding from the nose. Once it has been verified, place the patient in a comfortable position by head leaning forward. Identify the soft portion of the nose by placing a gauze or dressing pad over the nose. Ask the patient to breathe through the mouth while the soft portion of the nose is being pinched. Pinch the soft portion of the nose till the bleeding stops. If ice packs or cold packs are available, place it for 20 minutes. Do not place the ice cubes directly on the skin. If bleeding doesn't stop with all these measures, rapidly transport the victim to the hospital for further evaluation. This video demonstration is about the management of victim with external bleeding and how to control the external bleeding. The first step in managing a patient with bleeding control, ensure scene safety and standard precautions such as gloves, goggles and mask. Identify the site of bleeding. Place a sterile gauze pad or a dressing pad from the first aid kit over the bleeding site. And give a direct pressure over the bleeding site for a few minutes. And if the dressing pad or gauze pad soaks with the blood, add on few more gauze or a dressing pad, but do not take away the previous gauze pad which is placed over the bleeding site. Wrap the gauze or a dressing pad with a roller bandage. So the roller bandage has to be rolled in a circular way with a 2-finger width. The bandage should not be too tight or should not be too loose so that it should not compromise the blood circulation to the distal part. So once the roller bandage is placed, and secure the bandage in place by placing a adhesive tape or tying it around the wound site. Take the knot always away from the injured site. and reassure whether the bleeding has stopped or not, and try to keep the injured extremity above the heart level. After managing the victim with a bleeding control, discard the used gloves and mask in the biohazard bin or red colored bin. This video demonstration is about the management of victim with musculoskeletal injuries such as suspected fracture, sprain or strain or dislocations. With the available material, magazines, wooden planks, cardboards, bed sheets or handkerchiefs can be used as a immobilization devices. So ensure scene safety and standard precautions with gloves, mask and goggles. Identify the injured site before and after splinting. Always check for pulse, motor and sensory functions. So for demonstration purpose, we will be demonstrating on wooden planks and magazines. So the immobilization device has to cover the above joint and the below joint. So place the magazines by covering both the joints and ask the patient to hold it in position till the rescuer secures the magazine with the piece of cloth or handkerchiefs or roller bandages. So there should be a 3 points of securing needs to be done: mid portion, a distal portion that is farthest away from the injured site, proximal portion closest to the injured site, and check the pulse, motor and sensory function again after splinting or immobilization device is placed. So now the practical demonstration will be displayed on the wooden planks by placing a wooden planks. So same technique will be applicable here. So place the wooden planks by covering the above and below joint, and also always check pulse, motor and sensory function before and after. So same 3 points of securing has to be placed. So the mid portion, distal and proximal. Once the securing is done, place an arm sling around the neck for immobilization and support. So to do that, we can use a bed sheet or a towel or any cloth which can be used as a sling. So to place a arm sling, wrap the cloth around the patient's injured side, little bit away from the injured side, and take it equal length and place both the arms around the neck and tie the knot, which is easily removable at the hospital. And after the procedure, again check for pulse, motor and sensory function.
For seizure patient, you have seen in movie or social media, they will give the metal or iron rod. It's absolutely wrong actually. It's a myth. You should not do that. So what we are supposed to do is seizure activity usually will complete within 30 to 60 seconds. So wait for that. Make the patient to a left lateral position. Okay. All the saliva will drain out or the vomitus will drain out. Suppose they are giving me knife or something else, I'm seizuring activity. I can poke myself. Suppose I poke in the carotid artery, I can die. Okay, I poke in some abdominal mesenteric artery there, I can die. So never ever give a sharp object to a seizure victim. It will rest by itself. Don't do anything, just make the patient to the left side. Okay, suppose that in schools also we have fainted in prayer due to hot summer. So what our teachers do that day? Water, they will make the flat and they will keep our legs elevated. Have you noticed that? So that is for the proper venous return to your brain. So never sprinkle water on them. Okay, tell them you are all right. Don't get panic. They become unconscious. Start your billet. They're conscious. Give them 1 teaspoon of sugar, or take a warm water or a plain water and mix with 1 spoon of sugar and a little bit salt, and you can give them because they would have dehydrated. So you can give them a fresh water. Okay. Suppose the patient is unconscious, don't give anything through mouth. Some people will sparkle, some people will try to pull water. When you give water, in case of fainting, that will be considered like this. So when you give water to the person, it will block the airway. The patient even can die because of aspiration. The water entering inside the esophagus can enter into the trachea. So don't give water or sprinkle water. Suppose the patient is having any anaphylactic reaction by eating peanut or some prawn, seafood. Okay, make sure that you rush the patient immediately to hospital. Give them the fresh air. Usually in abroad they use a epifen, adrenaline auto injector in their packet. So that we can take and we can auto inject. Suppose the patient is a known chest pain patient, they will have a logo and so on and so this condition. If I get a chest pain or panic, you take the tablet from my wallet and you can give me to chew. So the people those are there, they are more alert than Indian. So even it will come to us in 2 or 3 years, till that you can have this. Suppose the patient is an asthma patient, they are calling you help from the neighborhood. So you can go and ask them whether you are using any inhaler or puff. So give them immediately because it's a bronchodilator. It will relax our lungs and make the bronchus dilate and make the breathing difficulty also the normal breathing. Have any doubts in first aid apart from this topic? If you have snake bite, you should not tie a rope or you should not cut the venom and take it off. We should elevate the arm. That is we call it as a right. RIGHT. R is for rest and reassurance. Okay, reassure them, we will rush to hospital. I used to information. How did he get the snake? Don't ever go back the snake and try to catch it off. It's not our job. We should see what kind of snake. If it is possible, we can tell them. So collect all the information from the patient attender and GHS, get the patient to the hospital. And TS treatment. Do not delay the treatment, should be given. They'll give anti-snake bite.
Any more questions, participants? Any questions? Ma'am, I have a question. So sometimes what happens is students don't eat in the morning, or they have their monthly periods or whatever, and they become unconscious. So as teachers, how do we handle that, or what kind of first aid do we give them?
We should check for the response as we done for BLS. They really become unconscious, you can start at least 1 cycle of CPR. If they really dehydrated, you can give them a cup of fresh juice or teaspoon of sugar and make them to sit right. If the patient is speaking to you,
Okay.
unconscious, you should not give nil per oral, not give anything too much.
Okay. Okay. So is there any position in which we have to,
We should make the patient flat and keep their legs elevated into the chair. So the proper drainage will be going to the brain, the venous system.
All right. Thank you, ma'am. Any questions, anyone? Questions or comments?
Don't skip your breakfast or lunch. Your health is more important than anything else. Okay.
Teachers.
And so I just wanted to show you that how to do if they faint or if they go unconscious, what do we do?
Okay.
I told her she
Can any volunteer can come? Any volunteer? can lie down. Lie down, lie down. Elevate your legs. Okay, you can keep like this. So you can see this is called as Trendelenburg position. Head will be low, feet will be right. It's called as Trendelenburg position. So automatically the blood circulation from the legs will go to the brain and will prevent the proper circulation. Okay, this you can do. It's not like too quite at least like 2 pillows or a little.
Participants, you can also question.
You can sit and ask, no problem.
Ma'am, what kind of first aid should be given to a person who's experiencing a panic attack?
Panic attack, make sure you give them confidence first. You tell them nothing to worry. Please sit down for a while and take a deep breath. Ask them to take a deep breath and relax. And keep on telling them, did you need anything to eat? Did you have anything in the morning? So make sure the person doesn't feel loneliness. So once they're all right, they will tell what happened actually. The exam fear, you will get panic. So that things can be there. You can tell them you will definitely pass a good mark. There's also the next semester you can write up
For some person, it will be very severe, right? The claw hand will be clasped.
in that case, you can rush them to the nearest hospital. You can give them the first aid like assurance and make sure the patient is conscious oriented. Then you can rush them to the hospital.
Thank you, ma'am.
Always reassurance matters, okay? Whether the person is hearing out or not. Please make sure you're giving enough support, moral support to the patient.
Any more questions?
What to do if people get fits, ma'am? Like
Fits is seizure. Fits is layman term, seizure is a medical term. Okay.
You can also share your views on the session. Participants, anybody who likes to,
Have any doubts, you can ask.
anyone who loves to share your comments, views, you can. Over to Nirmala, ma'am.
Ma'am, share. You can sit in.
During seizure, some people advise that you have to stuff their mouth with between the teeth some cloth bundle or something so that they don't hurt their lips or something. Or is it advisable?
Actually, we can keep a small soft cloth, ma'am. If it is clean enough, we can keep it because they will bite the tongue and the tongue can bleed. Usually in hospitals, we usually keep a tongue depressor or a oropharyngeal airway. If you found any, but you should not also keep during seizure activity. Once the seizure activity stops, you can able to keep.
Thank you. As we come to the close of this incredibly insightful and practical session, it's my privilege to propose vote of thanks. First and foremost, on behalf of the organizing committee, I would like to extend our deepest gratitude to our esteemed guest speaker, Mrs. T.N. Nirmala. Ma'am, thank you for sharing your profound knowledge and vast experience with us today. Your lecture on how to be proactive during medical emergencies was exactly what we needed. As educators, we are often the first responders when a student faces a health crisis, and your clear step-by-step guidance on managing students with health issues, especially handling common but stressful situations, has given us a renewed sense of confidence. A very special word of appreciation goes to you and your dedicated team for the hands-on CPR training. To the team members who assisted, thank you for your patience, your expertise, and for ensuring that we all understood the vital mechanics of saving a life. I would also like to express my sincere gratitude to the organizing committee for organizing this workshop as part of this FDP. Thank you all once again for being a part of this memorable and highly educational. Thank you.
Stay back for your photo session, girls.